Hello everyone, my name is Emma Netches and I was in a group with Margaret and Johanna, and today I will be teaching you guys about iron deficiency anemia. So what is iron deficiency anemia? It is a condition in where there's a decrease of normal red blood cell levels and the amount of hemoglobin in those red blood cells. And the amount of hemoglobin is what helps your red blood cells carry oxygen to the rest of your body. So a decrease in that lowers its ability to do so. In women, you can be diagnosed with IDA, which is iron deficiency anemia, when you have a hemoglobin of less than 12 grams per deciliter, and a hematocrit, which is the volume of red blood cells, that's less than 36%. And then in men, you can be diagnosed when you have a hemoglobin level, which is the iron in your red blood cells, of less than 14 grams per deciliter, and a hematocrit of less than 41%. So some causes for anemia that your relative may have, or some symptoms, my bad. So they may have leg cramps, craving for ice or cold foods. Extreme fatigue is also common because your body is having to exert more with less oxygen. Weakness, pale skin is another one, chest pain or a fast heartbeat, cold hands and feet, inflammation or soreness, brittle nails, and then a poor appetite. And with iron deficiency anemia, these symptoms usually start small and then they can progress to become more severe as your body keeps getting less and less iron in the blood. These are just the most common symptoms. So there's some causes of iron deficiency anemia. There's a few main ones. It's caused by an inadequate intake of iron, so you're not eating enough iron, maybe you need supplements. Or it could be an inadequate storage of iron, so your red blood cells are not able to fully store the amount of hemoglobin that they need. Excessive loss of iron, or some combination of any of these three causes. And then without enough iron, your body can't produce enough of the substance in red blood cells that enables them to carry oxygen, which is that hemoglobin. So your relative may be having this. And then there's also a few pathological causes, which is basically just potentially another disease could be causing them. And that could be an ulcer, maybe a hernia, malabsorption syndromes, varices, or tumors could also be behind it. And then for women, there's some special causes with menstrual blood loss that can also decrease your iron levels. And then also if you're pregnant, that can decrease iron levels because you are trying to give enough oxygen, support, and iron to your baby as well. So then assessments and diagnosis. So there's going to be a few different examinations that we'll do. For the physical exam, the physician will inspect the patient's mouth for signs of inflammation and tongue atrophy, which just means that your tongue is smooth. And then they'll look for brittle nails and hair, which is also one of the symptoms. And then any rapid breathing or abnormal heart rhythms. We'll also run some diagnostic tests, which is a bone marrow biopsy that may show a staining for iron in the cells. We'll do a complete blood count just to see what your red blood cells levels are, and then the amount of oxygen in them. And then another test we can do is the serum ferritin test, and that just tells us if the red blood cell count or hemoglobin count is less than 10 grams per deciliter in women and 20 in men. And then also do a psychosocial exam because sometimes you can have anxiety with this, and for you guys as the family as well, it's important to stay healthy mentally and to feel supported. And then also stress can be a side effect, and potential upset about body changes such as pallor or weight loss that can come along with this. So if you guys need any support, feel free to ask us questions or anything at all, and we'll be happy to help you and guide you. So then for treatments, we have two goals when treating your relative that has iron deficiency anemia. And the first goal is to correct the underlying cause that is causing the iron deficiency, and then the second is to correct the iron deficit. So we'll have a few ways of doing this. Medication therapy is the main type of therapy we'll do. The doctor may recommend over-the-counter iron tablets to replenish your relative's iron supply. And then the doctor will let you know the correct dose for them. Iron is also available in liquid form if your relative is a child, because that will be easier for them to take. And then to improve the chances that their body will absorb iron, because iron can be kind of hard to absorb, you can try to take iron tablets on an empty stomach, and that will just ensure that it doesn't get mixed up in the food. However, sometimes iron can upset the body, and so it might be important to take it with a meal, and if you have to do this, taking it with vitamin C, it can really help the body absorb that. And then iron supplements can also cause constipation, so the doctor might recommend a stool softener. And it could turn your relative's stools black as well, but that is a very non-harmless side effect. And then also just eating foods that are rich in iron will be really helpful. In the most severe cases, a blood transfusion may be necessary, but that's only if we can't get the levels up through all of these other options. So then prognosis and follow-up. Iron deficiency cannot be corrected overnight, but in a few weeks your relative should start to feel better if they're taking their supplements and following their treatments. We'll do blood tests every 2 to 4 weeks in severe cases just to make sure that levels are improving. And then follow-up appointments with the doctor if necessary, just to make sure that your relative is not regressing and that things are continuing to improve. And like I said earlier, your relative should be feeling better within a few weeks, and if they're not, it might be important to revisit the doctor so you can figure out if there's another cause. So these are our sources. If you have any other questions or information that you'd like to look up, you can consult these. Otherwise, there's lots of other information too. Thank you.